on LBC. Call 0345 6060 973.
It's 9 minutes before 8. Back to our conversation about the people who are not at their desks, offices, places of work, schools, wherever it might be, hospital wards in a moment. But who knows what happened a year ago today? Anybody? Well, let's turn to someone who certainly will know and knows the importance of it. I speak of Conservative MP and Vaccines and Public Health Minister Maggie Throup, who indeed has a piece in one of our newspapers this morning in The Eye, talking of the anniversary of... Good morning, Minister. Remind listeners what happened this day. Good morning, Minister. What happened this day 12 months ago?
It's actually exactly a year since Brian Pinker had the first dose of the Oxford AstraZeneca vaccine outside of clinical trials. And since then, we've gone on to deliver 50 million doses across the UK and 2.5 billion doses across the world. And it's a great testament to British research and innovation. And it's incredible news.
Noting that you weren't in post that you are in at the time, but is this in reality your colleagues who were with you then, who were with you now? Is it beyond what they had hoped for? Is it a little bit where they thought they would be? Could they have done better? How would you characterise it, Minister?
I think our vaccination programme has been incredible. It's been the biggest vaccine programme the NHS has ever rolled out. And I think it's recognised worldwide as being one of the best, but both from the breadth and also the timescale. So I think it probably has exceeded expectations. But then we know that the NHS is always there to deliver for us, whether it's a vaccines programme or anything else. And also our great British industry and research as well. I mean, it's everybody coming together to make it such a fantastic day to celebrate today.
What are the hurdles that we must overcome over the next 12 months, Minister?
Well, there's still some vaccine hesitancy, but I think what's been really interesting over the recent weeks is people have been coming forward for their first dose that were a bit sort of hesitant before. I think just promoting the booster programme has really helped people realise the importance of the vaccine, whether it's the first dose, second dose or the booster. So I want to encourage everybody to continue to come forward for their vaccine as soon as they're eligible for it.
Well, amen to that, or hear, whatever one says. I have to put you... we took a call from a listener earlier who was suggesting that there is actually a high percentage of the population who can't have it for health reasons. The caller quoted a figure of 8%. Now, we've looked everywhere. We cannot find anything like... I thought it was below 1% of people who medically couldn't have it because they might have some adverse reaction. Are you aware of any definitive figure, Minister?
Well, I think it depends what your caller's talking about. It could be the fact that if you've had COVID recently, you can't have a vaccine, whether it's your first, second or booster dose, for 28 days. And probably it's about 10% currently who can't have their booster jab. So it could be that figure. And as you say, there are some people for other medical reasons, which I'm sure will be a lot lower. So I think it could be the fact that at the moment they can't come forward. But as soon as that 28 days is up, I'd encourage them to come forward and boost their immunity through the booster programme or have their first dose or second dose.
That's possibly where... I'm grateful for you tidying that up. Now, as Public Health Minister, you'll be aware there are concerns as to whether hospitals can cope, and some hospitals are saying that they're in pretty dire straits as regards staff shortages. It was just last month that your colleague Sajid Javid pointed out that 7.25% of NHS staff have yet to be vaccinated. Are you disappointed by that figure?
Well, all the time they're coming forward to get their vaccine. I think I always am disappointed when people don't come forward for their vaccine, especially in the health and social care sector. My father was in a care home for over 7 years, so I just know the importance of those the care staff, whether it's in hospitals or in the social care sector, how close they are to the residents or to the patients, and they become like family. So I think people have understood that and are coming forward to have their vaccine. But I want to encourage more and more of people in the care sector, whether it's the NHS directly, to come forward for their vaccine. They protect themselves, they protect the people they work with, both whether it's patient or resident or the other members of staff that they're working alongside.
You referenced the care home sector. You're probably aware that, again, in that industry, bosses are talking about a 20 to 25% lack of staff or shortage of staff due to being people stuck in self-isolation. When will the number of days required be cut from 7 to 5, as is being mooted, Minister?
Well, we always look at the clinical evidence, as you can imagine, and we've recently reduced it from 10 days to 7.
Indeed.
At the moment, actually, we don't feel it's appropriate to reduce it any further because we'd be very concerned that people will still be infectious and be able to pass on the disease. So I think we've got a measured approach at the moment where people need a negative test on day 6 and a negative test on day 7 to make sure that they are able to go back to work. And I think it's the right thing to do. We need to protect everybody in this instance.
So there's no change in that likely in the short time?
No,
Okay.
not expected.
What about moving back to Plan A? Is there likely to be any movement there, Minister?
Well, we're on Plan B at the moment, and as we've seen, infections are still rising. I think it's a measured approach. We're asking people to work from home, but it's mandatory to wear face coverings in a number of settings, as well as the COVID pass. At the moment, we are looking at the data very, very carefully, but as the Prime Minister said yesterday, then at the moment we're sticking with Plan B.
All right. Does that mean that we're likely to be wearing face coverings through this summer?
Look, Plan B is renewed every few weeks. I think what we need to make sure is that we get through this particular wave, and the best ways we know is for people to get their vaccine and also to continue to test when they go in different places to stop that transmission. I think that's the important thing. Everybody's playing their part to make sure that we can overcome this wave we've got at the moment.
But do you think we'll still be wearing face coverings in months to come, Minister?
I think one thing I've learned with this pandemic is the one thing that is predictable, that it is unpredictable. So I'm not going to make any predictions for that. But I think people are playing their part to make sure they keep themselves and other people safe.
And just on that particular aspect, is there not a fear that as school children go back to their classrooms, which actually starts today and runs through about the next week, there could be a huge spike and there could be a real lack of teaching staff due to self-isolating and the pupils? Again, I return to the idea, isn't that forcing the debate about coming from 7 days down to 5 for self-isolation?
I don't think it is forcing that debate, and so I think it's important that we follow the clinical evidence for self-isolation. But it's important that we do keep that face-to-face teaching for students, and that's why we're introducing the testing as students go back into the secondary schools and into colleges and universities, and testing for the staff as well, and also wearing face coverings within the class environment. I think there's nothing better than that face-to-face teaching, which is so vital for the future of our young people.
Lastly, it's wonderful to speak with you. It's been over 100 days since you took your post, and this is your first what's called media round. Where have you been, Minister?
I've been very busy. I've done lots of different media.
The great Zahawi was a busy chap, but he was able to come on regularly, your predecessor. Why has it taken so long?
I've been on LBC before. I was on one Sunday. I've done lots of different media interviews.
Okay.
So it's always good to be on. And it's such a great day to be on with this anniversary.
So I can look forward to, because you are a key person, because my listeners do have, as we've explored, a concern about the vaccines. We can look forward perhaps to more frequent conversations, Minister.
I'd love that, yes.
Okay. Yes. Lastly, I can't let you go. The biggest political conversation at the moment, Tony Blair. Sir Tony or not? Where do you stand on that, Minister?
I think he did lots of good things, and I think it's only right that we do honour our previous Prime Ministers. He was Prime Minister for such a long time, and I think obviously it now opens the doors for others to be recognised in the same way. Everybody has their part to play.
I'm grateful for your time. I look forward to speaking more frequently. Thank you indeed. Vaccines and Public Health Minister Maggie Throup appearing here on LBC, where at 8 o'clock the news is next.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 8 o'clock, health leaders